Greetings, everyone. It is World Benzo Day, July 11th, 2018. This is my second year participating in this event. It also marks 2 years since I jumped off taking Xanax. I had tapered down from 3 milligrams to 1 milligram, and I was already in withdrawals from opiates and wasn't thinking well and jumped off. I do not recommend it. I do not recommend it. So, in addition to it being 2 years since I jumped off, I did have a couple doses from the hospital. I was hospitalized. I was in the ER 6 days after I jumped, and they gave me Ativan. Then I was hospitalized in August and again in September, both for 12 days. The first time they did give me more Ativan. It was very apparent that these clinicians, doctors, hospitals, and therapists had no idea of the dangers of benzodiazepine withdrawal syndrome and how 30% of those prescribed benzodiazepines suffer for weeks, months, and some people like myself, even years, while they're on them and they're off them. I suffered for 2 decades with severe insomnia. I had paradoxical effects from the medications that I took as prescribed by my physicians. I was polydrugged, and I was on over 19 medications between 2010 and 2014 when I decided to start tapering. I want to tell my fellow sufferers, you are a brave, 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 strong bunch of people. There is nothing more difficult than this. Nothing in life is more difficult than coming off of benzodiazepines and other psychotropics. There is nothing. If someone finds offense to that, then I am sorry, and I will never ask you to find out for yourself because that's how bad it is. I would never ask somebody to just see for themselves how bad it was because it's that bad. I'd never wish that on anyone. I am healing, but I still have waves. I've been in a wave the last couple, at least a week. Preparing for World Benzodiazepine Day has been a challenge for me because I have looked back to all that I have gone through. And I've looked back at all that you, my fellow sufferers, have gone through. It's quite horrifying. It's just simply horrifying. The akathisia, the dystonia, the suicidal ideation, the anger, the rage, the irritability. It's really horrifying. And yet, there's nothing we can really do about it. And that's the hard thing. You just have to keep pressing forward. You have to keep tapering. You have to accept that a medication isn't going to make it better. While I do have waves, I'm not really suffering anymore. I know what suffering is, and I'm not suffering. It's still hard. It's not who I want to be. It's not how I want to be. But I'm not suffering. I don't have the racing thoughts. I don't have the oh gosh, I can't even think of the word That is one of the symptoms that I still have. I cannot find words. But I do not have, the electrical shock. I don't have the deep, deep bone pain that just is overwhelming. I don't have racing thoughts. I don't have all kinds of strange thoughts that plague me. I don't have suicidal ideation. I don't have rage. I still have high irritability, and I still have a lot of anger. And that might take a while for it to go away because a lot of bad stuff happened during my years of dealing with all of this. I hope that when you see people like myself who have gone through the worst of it and are a better side, even though we're not fully healed, I hope that gives you encouragement. I hope that gives you some trust, because I know we have lost trust in the medical profession, and all we have is one another to truly trust of what do I do next, and am I going to be okay, and is this typical for someone to feel this or experience this? Because when we ask the physicians, they just say that we need another medication. When we talk with our families, they think we need to go back into the hospital or we need another medication. No one understands that it is the medicine itself that is causing all of these problems. So, if you're still suffering, you're in my heart every day. Every day. I ache for anyone who is still going through this. It's just very hard. It's so painful. Pardon me, I still have allergies, as well as this is emotional, and I was hoping I wouldn't, but it is emotional. It is painful. To the general public, I would just like to say, we aren't seeking any attention. We aren't seeking anything except a little understanding and a little compassion that we're really sick, not because we're crazy, not because we need to be on medications, but because we did take medications that harmed us, and that it takes a long time before we can get back, and we never really get back. We don't get back. We get to whatever is our new normal, because there is no going back once you've gone through this. No one is ever the same. No one. You might get to where you're cognitively well and you're happy, but it changes you. It changes your perception of life. It changes your perception of humanity. It changes your perception of the medical community in a very big way. And we would just like to be recognized that this isn't not real. This is very, very, very real. And people are dying from this daily, weekly, monthly. You are seeing it in the news. You are seeing it with your beloved actors and actresses and your performers and your musicians. You are seeing people that have had to go through what I've gone through, and they can't manage it, and they aren't getting the support. And they don't know that their brains are telling them these horrible things, and they take their lives because they think that's the solution. You see it. Please don't ignore it. Please don't put it into some other category. It is not addiction. It is doing what our doctors told us to do, whether it be for a sleeping problem or anxiety or for a seizure disorder. We've only been trying to do what our doctors told us to, and it was killing us. It was literally killing us. To the providers, please listen. Please stop and listen with no judgment, without looking for a diagnosis, without your flow charts of, oh, she's got this, this, and this, so it's automatically this, and we automatically write this prescription, and that's going to fix it. Because that is a horrible way to treat people. That is a horrible way to practice medicine. We aren't diagnoses. We're human beings being human. And we have symptoms. And sometimes we just want someone to hear about the symptoms and acknowledge that they're real. And then give us some kind of encouragement, not another pill, or not telling us and shaming us that we're crazy or that we don't know what we're talking about. We do. There's thousands of us across the world. There may be even up to 1 million of us across the world that are suffering because you do the easy button. You pull out that prescription pad. In 10 minutes, you make a judgment in 10 minutes of meeting us, and you pull out a pad and put a drug in us, a toxin, a chemical, and that is supposed to be the solution. You are failing. You get a big, fat fail. As a true practitioner of medicine and of a healer of human beings, you fail. You fail miserably. So I challenge you to listen to those of us that are trying to explain to you the realities of this. I challenge you to let us put up our flyers where people can get information about what this is. I challenge you to help patients with slow, careful, caring tapers, with support, with encouragement, with involving the family of the reality of this. I challenge you to do better. I challenge you to find another way other than that prescription pad of treating people that are hurting in life. You fail. You fail. Read about Heather Ashton. We need more people like her. We need more scientists that are really caring about what happens with those prescriptions you so quickly write. My prescriber wrote for Xanax for 4 years, up to 3 milligrams a day, routinely. I've gone through my records. I told her I wanted off medications. I got absolutely none, zero, no instruction, no supportive measurements, nothing. I had to figure it out myself. I had to do it all by myself. And when I crashed, well, see, she needs medications. Well, you know what? I haven't had a medication from a doctor for 6 months other than my inhaler. I do not take any prescriptions anymore. None. And I guarantee you I'm not crazy. I'm not bipolar. I'm not anything except trying to heal. I do have PTSD, and that's a whole nother story. But even with that, I'm learning techniques to manage that without medications. But I had to seek it out. It wasn't easily offered. Not like the prescriptions. That pisses me off. It really makes me mad. Had I not done what I've done myself, finding a way, prescribers would have killed me. That's a fact. That is a fact. I also encourage prescribers, therapists, and family members. Check out Benzo Buddies. Go on there and see how many thousands of people are talking about this. It's not just a handful. There's a lot of us. Please, give us that at least. Therapist, I want you to know that during my detox and probably the first year in withdrawals, there's no way I could have done active therapy of any kind. I could have not done cognitive behavior therapy. I could have not done dialectical behavior therapy. I could not have done acceptance and commitment therapy. I could not have really participated on a routine basis, the way you might ask, in meditating. I was doing everything I can to just literally breathe and try to remain somewhat calm. We need compassion. We need a quiet place. We need love. We need empathy. We need to be treated like a child that needs everything done for them. That's what we need when we have to come off of these medications. We need someone to love us like you love a 1 or 2 year old. We need someone to watch out for us. We don't need more medications. And we can't do therapy and treatment. After a while, I was able to do that. And it has helped me tremendously. And I'm still involved with therapy. I've done all those. I've done many classes on cognitive behavior therapy, on emotional regulation, on acceptance and commitment therapy. I have those tools, and today they helped. But in the midst of it, it would have been no benefit because I could not cognitively even do that. It's too much. Please understand this. When we tell you we're doing our best, please accept that for the day. Our best is our best. If all we can do is wake up, go to the bathroom, get some water to drink, and not lose our mind completely, then some days that's the best. So please, don't tell us to try harder. We're trying harder than you could ever imagine. Please don't tell us to just pull our bootstraps up and get over it. We don't even know how to find fair boots. Lastly, for family and friends, I don't even know what to say here. The hurt and disappointment and the anger that I feel about being treated the way that I was when I was so sick and so alone, it's going to take a long time for that anger and that pain to go away. I was treated like a criminal. I was treated like I was misbehaving. I was treated like I wasn't trying. I had people tell me, just go to the hospital. It's too bad if they don't have your food. My food, I have real food allergies. And every time I went to the hospital, they messed up and I was sick, which added to my distress. You have no idea. To say that to me when I'm going through the things that I'm going through, wow. Wow. You know, anyone who thought, oh, she just isn't trying hard enough, or she's just not doing what the doctors say, or she's not going to the hospital, or she's just getting all her stuff all worked up. I've done my best. And I have proof. I'm still alive. And I'm still moving forward in life. And I'm going to continue to move forward in life. regardless of who's there and who isn't. Last summer I was discounted again when I was still in the throes of it, and on top of that I was having cardiac issues and breathing issues because of the air. And I still was treated like I was crazy and cruel and mean and not acceptable. Well, as someone that has gone through all I've gone through and is coming out on the other side and is off all medications and is somehow eking out a living and a survival and still smiling and still friendly and kind to people and still able to make decisions on a day-to-day basis, I think I'm rocking this. I think I'm doing very well. If you had any idea of all I've gone through, of 30 years of being polydrugged, with my first benzodiazepine in 1985 when my son died, you might have treated me different, and you might think different. So I hope that if you are a family member or a friend that I have let go because of being so poorly treated at the worst time in my life, I hope you heed this for anyone else that you encounter that may be going through such a terrible, terrible thing. I truly would not wish this on my worst enemy. I would do pretty much anything than go through that again. Cover me in spiders. Put me in a tank with snakes. Give me a disease that's going to kill me in 6 months. I'll take all of those before going through what I've gone through. And I'll tell you why. Because you'd pay attention to that. It wouldn't be so easily to discount that. I wouldn't be invisible in my pain anymore with those kind of things. And I wouldn't feel so alone while I hurt. I will always be there for people suffering, coming off pharmaceuticals. I will always continue to support benzodiazepine withdrawal syndrome sufferers. I will continue to share the word on what we go through. I will continue to push for scientific studies that are real and not by a pharmaceutical company trying to find a new drug for us. I will be speaking with doctors and nurses and therapists for years down the road. And maybe someday I'll be able to open my Serenity Sanctuary that is in my heart and is in my mind. A special place for people like us that have suffered to go and get love and get acceptance and get kindness and get empathy and be fed and be cared for and be helped and encouraged while we go through the worst thing that anyone truly could go through. I have a dream for that for us. And it may be 2 years down the road, it may be 5 years, it may be 10 years. And I may not be the one to create it, but I already have it in my head, and I'm going to share it over and over and over till someone makes it happen. So other people don't have to hurt all alone in a tent or in an RV with the elements and the temperatures and just feeling very left out and very invisible to the world. I will never be invisible. I will live out loud because I am still alive. Thank you to my benzodiazepine warrior friends. Thank you to those that went before me and gave me their expertise and gave me their experience and their strength and their hope. Thank you, Heather Ashton, for caring. And thank you for the people who have been there through all of it. I will never forget you. Much peace and love.